So welcome everybody. We're still a little bit early, but welcome Breda and Peter, Seamus. Welcome everybody. Welcome Charlotte and Kevin, Noor. And welcome William. Welcome Maria and Christine. And Charlotte, welcome. Okay, and Hala, we're at the top of the hour. And hello from a very rainy Dublin. Yeah, it's rainy all over Dublin. Dublin 7, County Dublin, it's rain everywhere.
Yeah, thank you, Nadine. So welcome everyone to another webinar of Conversations on COVID-19 series. I'm Hala Ali, the coordinator of Eastern Alliance for Global Health Partnerships. These webinars take place monthly and will be held on the last Friday at 12 p.m. GMT of each month. We host experts from healthcare and global health fields to discuss various aspects of the COVID-19 pandemic. This webinar is the 18th in the series, and the topic today is health partnerships during the pandemic, contributions and lessons. A recording of this webinar will be available on our website and YouTube channels shown on the screen. Irish Global Health Network and Eastern Alliance for Global Health Partnerships. Live streaming is also available right now on our YouTube channel, Irish Global Health Network. If you have any questions during the webinar, please use the question and answer feature in the bottom of the screen. For now, I will leave it to you, Nadine, to my co-host, Nadine Ferris-France, the Executive Director of Irish Global Health Network. Nadine?
Thanks, Hala, and welcome everybody. It's good to be back. We had took a little break over the summer months here in Ireland, so it's good to be back, and very good to be back to focus on this webinar around health partnerships. And I think it's particularly interesting to have our speakers here today sharing with us. You know, a lot of the organizations and institutions here have been involved in partnerships way before COVID came on the scene, and it's really interesting to see how those partnerships have been able to pivot, and a new word I know we're all getting used to pivot and to respond to the specific needs that were generated and are still being generated by COVID. So very excited to hear how this, and it's a great way for us to see how the approach of health partnerships are there as a sustainable support rather than a kind of a project by project basis. So really excited. We have some great speakers here today with us. We have David Weekliam, many of you know, and from previous webinars, David is the Global Health Program, he's the Program Director for Global Health in the HSE, the Irish Health Service Executive, and he's also the former chair and currently still a board member of the Eastern Alliance for Global Health Partnerships, which is a co-host for this webinar. We have Francis Nyakujo, hope I said that somehow well, Francis, who's joining us from Sierra Leone today in Freetown, and he's the Emergency Program Manager with Concern Worldwide. He's been there for 4 years, a medical doctor, and he has many years experience coordinating projects in humanitarian and development contexts. And we're going to hear today from Francis more about the partnership that was formed as a result of COVID between Concern, Goal and Trócaire, 3 of our large NGOs here in Ireland, and how that partnership has been working alongside the Ministry of Health and Sanitation. So very interested to hear about that. Welcome, Francis. We also have Desalin Tai from the Ministry of Health in Ethiopia. He coordinates the Quality Improvement Case Team at the Ministry of Health there. And he's going to be speaking about a partnership between the Irish Health Service, the HSE, and the Ministry of Health in Ethiopia, and just telling us a little bit again about how that adaptation, how the partnership went on during and continues to go on in the context of COVID. So very welcome. We have Dr. Joe Gallagher. Many people know Joe. He is a GP in the PAM GP surgery in Gorey, County Wexford. We hope it's sun shining down in Wexford, unlike Dublin. We know that Joe and others have been involved in an amazing partnership between Malawi St. John's Hospital in Malawi there, and also the GP surgery. And during the pandemic, the partnership really pivoted and was able to respond in some very interesting ways. Also producing, and Joe will talk about this, a series of videos for healthcare workers that as of now are reaching nearly 1 million views, which is quite incredible. So we're looking forward to hearing more about that, Joe. And then lastly, we will be joined by Olimjon Said Mamatov, who is a researcher at the Urganch State University in Uzbekistan. And Olimjon will talk about a partnership that he coordinates that's funded by Esther Switzerland, and it brings together gynecologists from the Freiburg Cantonal Hospital and the Urgen Perinatal Hospital. So it'll be very interesting just to hear again how that partnership has evolved during this time. So I'd like to hand over to you, David, if I can. And you know, I know we worked together quite a lot, and we were involved a lot in partnerships for years. But when the pandemic hit in March, you were faced with quite a lot of uncertainties about how these partnerships continue. So, what have you know? Can you reflect a little bit on that? What have we learned, and what lessons have we been able to learn that we can share more broadly? Thanks, David.
Yeah, thanks, Nadine, and good afternoon to everyone. It's nice to be back after the summer break, even if the weather isn't great today. And it does seem, you said 6 months, I mean, it does seem like a good time to be reflecting. It is almost 6 months to the day when we had our first case reported in Ireland of COVID-19. So it's been a very interesting 6 months. So I'll kind of share a bit of maybe an overview of our experience here in our global health program and with Esther Ireland. And maybe by way of just kind of introducing it, to say that we broadly are involved with 2 types of partnerships. We have some national level partnerships where our health service partners with governments and ministries of health in other countries. That's mainly, it's Mozambique, Ethiopia, Zambia, Sudan. And it's great that Desalan is here to talk about Ethiopia, so we'll hear a bit about that later. And then there's also a lot of other partnerships that we support and facilitate. These are partnerships by different parts of our health service, involve hospitals, primary care services, public health departments, and so on. And our role with these is supporting and facilitating through sharing information, providing training, sometimes providing small grants, networking, and so on. And again, we have an example of that, and Joe Gallagher will speak about the Gori Malawi partnership as an example of one of the partnerships that goes on our health service. But just going back to March, I mean, March, things changed very dramatically and abruptly in March. And fundamentally, one of our main links with our partners broke. We couldn't travel, we couldn't meet face to face. And quite a number of activities that we plan with our partners are face to face. We run workshops together, we have meetings together, we have site visits, and so on. And of course, face-to-face is a key part of our relationship. We get to know each other and build relationships through face-to-face. So that was a new reality for us. And at the same time, our context in each of our countries changed very dramatically. So those of us involved in partnerships in Ireland were the same people involved in our health service response to COVID-19. So our capacity reduced to be involved. We were busy with our own national response. My own team, very much capacity was reduced. And the same with our partners, our partner countries, organizations. They were also involved responding to COVID-19. They had to redirect their resources, staff, etc. And one of the things we, of course, observed with our partners was that COVID-19 had a big effect of disrupting essential health services. And this was very relevant to our partnership work, because a lot of what we do in our partnerships is to strengthen these health services. So COVID-19 was disrupting and having a negative effect on things we were wanting to do together through our partnerships. So that was very, very significant for us. And maybe just to give one example of that, our partnership with Mozambique, where we're working with the Ministry of Health there to improve quality of care in hospitals. When COVID came along, many of the things that we're trying to do through this partnership were disrupted. We're trying to improve services for chronic diseases, for infectious diseases. We're trying to improve patient experience. We're trying to improve safety in hospitals. COVID-19 impacted all of those things. People were finding it harder to get to hospital. When they got to hospital, it was longer to be seen because there were different patient flows. There was less capacity because of COVID-19. There were risks from COVID-19 of getting it. So the whole lot of things that were affected. So really, it was very challenging for our work in partnerships. And we sort of had to sort of stop and think, well, do we continue what we're doing, or do we suspend it? Can we continue it and maybe adapt to the COVID-19 situation? And maybe are there new things that we need to do because of COVID-19? And so fundamentally, we had to change both what we were doing and how we were doing it. So if we look back now 6 months on, what I'd say is that for the most part, we had quite good experience of managing to continue the work of our partnerships. We adapted to COVID-19, so we worked on different things, and we were able to provide some additional support to respond to some of the needs that arose because of the pandemic. So I'm going to just touch on just some examples of that over the last 6 months. A few more words about Mozambique, which I mentioned, where we work with 17 hospitals and with the Ministry of Health. We had planned to do 2 workshops this year with hospitals in the regions in Mozambique. Well, that's off the table. That will have to wait till next year. Other work involved working with the hospitals in Maputo. And that is work we were able to continue because that work is led by the Assistant Director in the Ministry of Health who supervised the hospitals, and she was able to continue to work with the hospitals, visit them regularly, provide support and coaching. We complemented that with monthly webinars that we conducted with the International Society for Quality in Healthcare. And so that part of work was able to continue, and we adapted for COVID, and we introduced COVID into the discussions in the webinars. And one of the things that threw up was the added challenge of working kind of with different languages. That's more difficult online than face-to-face. So we dealt with that by inviting a global quality expert, Dr. Paulo Sousa from Portugal, to join us. And that's been a way that we've been able to continue to work there. Another example is Zambia. We send medical equipment to Zambia. Well, that's stopped for now. We've got 2 containers, loads of equipment ready to go out, but we have to wait. But other work is continuing. The work to implement specialist training for medical training for doctors. That program is continuing. That's led by the Zambian College of Medicine and Surgery and the Ministry of Health and so on. So that continues. And even though we can't visit, last year we visited for some training workshops, we can't this year, but we continue the relationship through video conferencing. And so that link does continue. And then there's lots of examples I could share from the various partnerships to Esther Ireland. So we've seen, for example, in Tanzania, in the Muhimbili Hospital, where the partnership there is delivering and developing and delivering cancer services for children. They've had to adapt and introduce measures to make sure that essential supplies of chemotherapy continues, to ensure that infection control is strong so people in the hospital are protected. Another example in Malawi, the partnership for people with albinism, developing services for them. The partnership has adapted. It's looked at ways to provide information to people with albinism, other ways of continuing the services there. So we've seen different ways in which the partnerships have been able to adapt. And then here in Ireland, in the ESTER program, we've done a variety of things to respond to needs that different partners have. So at the beginning, back in March, we were conscious of countries being inundated with vast amounts of information on COVID-19. And one of our responses there was to develop some guidance documents to support countries in really trying to understand what are some of the key responses that they needed to make. And some of that I think then was subsequently used in the training videos that Joe I think will speak about. Also together with the Irish Global Health Network, we've contributed to developing an online repository of resources, of sharing, disseminating information through our various networks. We've also introduced a small grant program, so partners that were having to do additional work or wanted to do extra things in response to the needs that COVID-19 threw up had some additional resources to do that. And of course, these webinars, another good example of something that has been developed as a result of COVID-19 has proved to be a very good opportunity for networking and sharing learning and experiences. And then just as a last example, I think we found ourselves doing a lot more international networking because we're all in the same boat. None of us can travel. So all of us different international organizations are having to figure out how do we work in this new way. And so we've had much more interaction with our partners, for instance, in the UK, through our UK and Ireland Global Health Network and having 2 weekly meetings. We've also been more connected with WHO, and we're now linking in with them around the new Health Services Learning Hub that they're establishing. So there have been some positive things that have come out of the last 6 months. So really, there's lots of lessons. Nadine, would I continue on some of the lessons, or would you like me to come back to that a bit later?
Yeah, I think it'd be great to hear just as briefly as you can, just the lessons, you know, what have we learned? It's very interesting. Yeah.
Yeah, no, I think lots of lessons, and just maybe to reflect on where we've been successful continuing working partnerships, what are the key factors? And the ones I've highlighted a few things. I think firstly, it's where the partnership has been strong, the activities have been able to continue and the partners continue to work. So it's about the strength of relationship, where there's already established trust, a build up of respect and mutual understanding, and where there's already developed that shared commitment to work together for long-term change, positive changes, and often underpinned by MOUs. So where that was in place, there was that sense of solidarity. We're in this together, we're going to stick together. And I think that sort of has proved to be very helpful as we've kind of confronted the challenges with the pandemic. For me, then, another thing that's been so important has been the local leadership. We're not able to travel, so anything that depends on us being in country isn't going to continue. But we've seen that where the local organizations and ministries of health and so on are in charge, then things continue. And I gave Mozambique as one example, but there's lots of examples where they're not our activities, it's their activities, it's their priorities, and they continue them because it's what matters to them. And so we've been able to continue to work with them in areas where we can still contribute, but at a distance. Another thing then is flexibility. I mean, this is a key feature of partnerships, is being able to adapt when needs change. And we've been able to do that. And where we've been giving funds to partners, we've been very much encouraging them to be flexible. And if they need to use them differently, we shouldn't be tied down to fixed deadlines and timelines about projects and delivering on projects. It's not about that. It's about, we're working towards long-term goals to improve services, and we need, if something comes up that confronts us that we need to deal with, well, that needs to be factored into the way we work together. Fourth thing is really, I think what we've learned is how some of the new ways of working are really effective. Now, I'm not naturally inclined to this online working and webinars and stuff like that, but they seem to work. We've had some very, very good engagement online. Many people have engaged, for instance, with webinars like this. And that to me has been very positive. We've seen the potential of reach. We can reach more people through online platforms. I mean, Joe's going to talk about the videos. I mean, it's phenomenal what we've seen in terms of reach, and we can learn a lot from that for future work. And then with training, I think the challenge has been put to develop much better online training tools and methods. And we now have access to those that I think are very, very helpful, which is really sort of, I suppose, the conclusion of this is that some of these new ways of working are actually very good, and they'll be here to stay. And I think that's a lesson. They're here to stay because they're good, they're effective, and they reduce our dependence on travel in the future. And so finally, I suppose for me, an overarching lesson is that institutional partnerships do work. They have worked during the pandemic. We've shown this to be a very good model for collaboration between different countries. And I think that that will continue to be the case both through COVID-19 pandemic and beyond. I'll finish there, Nadine.
Thank you, David. Thank you. And it strikes me as another way to say some of the things you're saying is also, I think what I've really seen is creativity. It's been incredible how creative we have had to be and have been, all of us, working together, particularly in partnerships where we thought things were not possible and then they became possible. Things we would never have imagined. So I love the creativity as well as the flexibility that we've been able to see. So thank you for that, David. And just to remind everybody listening, if you have any questions or comments, please feel free to use the chat, use the question and answer, and panelists may respond. We may come back, we'll try and come back around and get as many responses as we can. So I would love to move from rainy Dublin to Francis in Sierra Leone. We're very, very interested to hear about the partnership, Francis, that you're coordinating between Concern, Goal and Trócaire. We know that each of those organizations have been working in Freetown in Sierra Leone for a long time, but that COVID has given the opportunity for those organizations to come together with the ministry. Can you tell us a little bit about how did the opportunity actually come about, and what challenges are you seeing, and what is tell us a little bit more about the partnership itself. So over to you, Francis.
Okay, thank you very much, Nadine. Thank you for the invitation. to share our experience, the partnership experience in Sierra Leone. I have some few talking slides, and yes, so the partnership is between Concern Worldwide Sierra Leone with the goal and Trocare, working alongside the Ministry of Health and Sanitation and 3 national organizations. It's funded by the Irish Aid through the Irish Embassy Freetown, and the objective is to strengthen resilience, to prevent and reduce the spread and mitigate the impact of corona pandemic. We are covering 9 out of 16 districts across the country, and we are aligning our response with the national and district coordination framework. So it's really an important partnership for us, and we will look forward for having more engagement. It's an 8 months peer grant, which started in July and will end in February 2021. Next. The project has 3 key outcomes, and these outcomes are focusing on community knowledge and awareness on infection prevention and control, but also measures to prevent the transmission of COVID. So the partners do support social mobilization, information, community engagement, and information dissemination. We provide items for infection prevention and control, but also at facility level, we are preparing water and sanitation facilities to ensure safe access and delivery of COVID-19 and other essential health services. The second outcome focuses on supporting and ensuring effective operation of the quarantine facilities, the isolation centers, and support includes providing operational support like water and electricity for the admitted patients or patients or households under quarantine. The partners are supporting with food and critical non-food items to ensure that they remain in the quarantine spaces or the isolation center safely and avoid further spread of the infection. And the third outcome is focusing on the secondary impacts, as we have already observed over the last few months, the prevalence of food insecurity at household level has increased, and a number of households are reporting, starting to adopt negative, coping mechanisms. So the partners do support food systems and supporting labor for the households that are in quarantine, so that they are able to have their farms or their gardens catered for, maintained, as they are restricted from moving while in quarantine. Cross-cutting across the 3 outcomes is the gender responsiveness and the safeguarding, I think, which is very, very critical, and considering the most vulnerable communities in a country like Sierra Leone. Next. One of the key things in the partnership is the staff safety, and to facilitate staff interaction with the program participants. We have generated 3 scenarios, but in most of our activities do fall under the first and second scenarios. So we encourage and emphasize at all times to adhere to no the social distance and avoid touching as much as possible with colleagues or beneficiaries during service delivery or when supporting the beneficiaries, but also when there is close contact but no touch, to ensure they have the basic preventive, they apply the basic preventive measures. So at all times, we are encouraging the staff across the partners to have their face masks, to apply to ensure they maintain social distance and the hygiene and sanitation. And this covers across whether we are doing the trainings or distributions in the quarantine centers or meetings. So they are like the core standard operations for our partners. We do not have a lot of activities that really require touch when engaging the beneficiaries, apart from those few scenarios, especially in health facility care, like where concern is delivering activities under our Saving Lives project. We encourage staff to have the basic preventive protection as they go over their duties, but also based on the risk assessment on the activities they are undertaking. So in terms of the opportunities for the collaboration, I think this partnership has really been good across the different members. We have had an opportunity to cover, to scale up and reach more, accomplishing more than what we could have done as individual agencies. We have seen the 3 of us reaching a total of 9 out of the 16 districts in Sierra Leone, and I think that is really a very good opportunity for us to create impact for the beneficiaries. But also the opportunity of experience sharing and resources, sharing of staff who have a wider experience across different disciplines. We have seen sharing and supporting each other in technical areas, whether be monitoring and evaluation, designing tools, or technical support in the field in terms of assessment or providing or delivering services, which is really complementing the partners' effort to deliver better and safer services. The other opportunity that arose from this collaboration is further strengthening the relationship, because before the COVID-19 outbreak, already the 3 partners had a working relationship in Sierra Leone, stretching from the Ebola outbreaks period and working through until when the COVID-19 broke out. So that relationship has been further reignited and strengthened, and we are seeing us working more closely, complementing each other, supporting each other as we deliver on our results.
Mm-hmm. Francis, thank you. Thank you so much for sharing that with us. I think it's really interesting as an example of a very quick response and a coordinated response. You know, an 8-month project supported by Irish Aid, bringing the organizations together, working with the ministry. I think it's really interesting, as you're saying, to be able to reach all those other districts and to continue to collect the lessons that you're learning from this partnership. Francis, I'm going to leave it there and come over to Ethiopia if I can, for now, and we'll circle back around as I can. So Desalin, we would love to hear a little bit more about the collaboration that you have been involved in between the Ministry of Health and the HSC, and also ISQA, which is the International Society for Quality and Healthcare, and what's been happening during COVID particularly. Yeah.
Okay, thank you, Nadine. I'm very happy to be a panelist here in this important topic discussion. And the partnership between the Health Service Executive, ISQA, and Ministry of Health has been started in the middle of the 2019. And basically our engagement was initially in the QI capacity building of the public hospitals that are located in the capital Addis Ababa. And we have trained these hospital teams in the quality improvement, and they had their own project. The project has been followed through the 8 months period, and a team of trainers initially led by David came from the first time, and then they conducted the hotel-based training, and the hospital teams drafted their projects on different topics based on the national quality strategy disease priorities. And after a couple of months, the team from HSC and ISQA gave an online coaching via Zoom, and the totally 3 hotel-based capacity building and 2 online coaching sessions has been cascaded before certifying the hospital teams. Following the certifying the hospital teams in quality improvement training, we initiated the conversation with health executive and ISQA side, and the side, and then we had reached in a consensus to have 25. Hello?
Yes, we can hear you perfectly.
Okay, thank you. We just agreed on having 25 professionals from the ministry leadership, from the hospital leadership, and clinicians. Just they enrolled in the ISQA fellowship, and they are in the journey, currently having the fellowship journey. And these hospital teams and the ministry side are currently having the online coaching within their journey with the ISQA teams and Irish Health Executive teams. So regarding with our cooperation and our partnership, it is going very soft and very well, despite the challenges that we are having with the COVID. So the hospital-based training was planned to be expanded and scaled up in all over the country. Ethiopia is a big nation, and we have regions that are outside the capital, and so we planned to include these hospitals in the training program, and that was challenged, and the process is going to be postponed. So that was the challenge that we have faced. And the other thing is specifically with fellowship and quality improvement efforts, we had hospital teams who are reassigned to the COVID side. So this role reassignment has created a challenge in sustaining the quality improvement gains that we have got. And regarding with the solutions, the online platform has worked well. And during this COVID-19, even we have used this experience to scale up in the national level. And these times we are having trainings based on the online setups. And so this is a good lesson that we have learned, is to cascade trainings, to cascade the orientation sessions via the online platform. That's a good lesson. And the other one is when we are creating the partnerships. So we should have some plan B. Plan B. So in this case, the online platform has helped us a lot. So the partnership design should be also considering the challenges that would come later. And so this is a good lesson that we have received. The other one is the ISQA side has helped us a lot in capacity building. And we have had also the discussion on the sustaining the quality improvement efforts, the safety improvement efforts in the other ways. So the discussion has continued. The initially began discussion on the accreditation process, having the internal quality assurance systems has helped us a lot in dealing with this situation. And even we have got a good opportunity to advocate the safety and the quality efforts to be given a good leadership priority in Ethiopia. And so the hospital teams, the leadership, and the government is also considering to give priority for the quality and safety issues related with the providers, related with the supportive staffs in the hospital. So that's a good opportunity. The part regarding with partnership and the COVID brought to us, and we in the ministry side are utilizing, and we are very strong to do on these topics to further the initiatives that we have begun.
Thank you, Dezel, and that was really a very comprehensive summary, and just wonderful to hear how the partnership has been able to continue and almost springboard, in fact, from as you're describing it. Just looking forward, how do you think the partnership will be affected moving forward for your, the plans that were in place, and now what you've learned as a result of responding during COVID? How do you think the partnership will be responded or will be affected?
Yes, the partnership, basically the scale up that we have had a great lesson when we are working in the Addis Ababa, in the capital. So we had a rich resource and a rich potential is accumulated in the capital, and we want to expand that issue. So the partnership, basically within these three parties, the ISQA, the HSC, we plan to expand this situation, and this is due to the travel ban and the travel restrictions. We couldn't do that thing, but we have had a good opportunity to cascade these training capabilities to the hospital teams. So specifically, the partnership is affected by the travel restriction. And so for the ministry team, we have used the good opportunity of this the online platforms, but for the hospital teams, we couldn't do that. So we are to move forward. We are thinking in the ministry, specifically Ethiopia has its own calendar, and our new year is going to be begun within 2 weeks. So we are also having our own the national annual plan, and so we are going to include the online platform using the Zoom to cascade to these facilities in the coming year.
Yeah. Thank you, Dezel, and thank you so much for showing us what's possible, and also just to see, how we look at this. The travel ban. It's some things have been very badly affected, and some things have been very positive in terms of effect. I think we're looking at a paradigm shift in terms of development and development aid, which is maybe the subject of another webinar. So thank you for that. I'm going to come back to Ireland, from Ethiopia back to Ireland. And just before I open the floor for you, Joe, I just want to welcome our colleague, Ulma John. You're very welcome. I introduced you earlier, but welcome to be with us. And I'm going to come to you last after Joe. So thank you. So Joe, we'd love to hear a little bit more about the Gori-Malawi partnership, particularly about the response during COVID. How did you respond? What motivated you? How did you work together with the partners? And what lessons have you learned from that?
So I just want to start this up here, and hopefully now I can share. Yes, perfect. So thanks a million, Nadine and Hala, for inviting us to share our learnings, which have been very much driven by a collaboration, not just with our partnership, but with a lot of people on this call. I hope you can see my screen there now. Yeah, perfect. So for those of you who don't know, as Nadine mentioned at the beginning, this is a partnership between St. John's Hospital and its associated primary care clinics around Mzuzu in northern Malawi, and our very exotically named Palms GP Surgery in Gori in County Wexford on the east coast of Ireland. And our focus has been on non-communicable diseases and how we can both learn to improve the management of these conditions in primary care particularly. As we know, NCDs themselves are pandemic affecting, particularly low and middle income countries with high rates of premature mortality related to them. And we were very excited. We had a trip planned for March the 14th to fly to Malawi to start the next phase of our work involving building collaborations with Irish universities, workshops, training. As David mentioned, it was all set to go. And very quickly we realized this isn't going to be possible. And it was a source of great disappointment. And this other pandemic, which again was just announced on the 5th of January, if you look at here, totally interfered with our plans. And Peter and myself are the two people in Gori who tend to look at this. We were a bit like this famous Irish play, Waiting for Godot. We decided we'd wait for the COVID-19 to finish. And as time went on, we sort of realized it's not going to finish and we're not going to be able to travel very far. And inspiration came one Friday afternoon when we were sitting in the surgery watching one of these webinars. And as Peter has highlighted before previously, we began to realize whatever our partnership was about, it was now going to be about COVID-19. And we sort of had to change from our focus on NCDs to COVID-19. And with a few WhatsApp messages, it became apparent that everyone felt that in the partnership, not just us, but our colleagues in Malawi. And we started to have some lively conversations online and via WhatsApp around what should we do. So our first immediate response really was to repurpose some of the finances we'd put aside for our trip to more physical resources, such as some PPE, pulse oximeters and thermometers, and support from patients and staff to create some materials as well and ship them to Malawi. And then we sat down and had sort of a rapid needs assessment using email and online meetings to see, well, what do we need to focus on in this apart from that sort of physical and financial help? And one of the key themes that emerged was there was a real need for education for healthcare workers and healthcare managers. And as highlighted, there was huge amounts of information coming us at that time. It was changing rapidly. It was difficult to appraise the evidence. The documents were too large, particularly for busy clinicians and healthcare managers who are trying to sort of set up their facilities for this. And in particular, felt a lot of information wasn't relevant to the situation in Malawi, where perhaps the resources talked about in a lot of these documents weren't available. So the solution we came up with was that we did a sort of a review of the current international guidelines, see what areas are they covering, and then share those with our colleagues in Malawi who identified the key areas that they felt needed to be addressed in these education initiatives. And the next question was, well, how do we do it? And using the mobile broadband that was widely available in Malawi, it was felt that some short 2 to 3 minute videos that could be easily disseminated by WhatsApp or social media would be the way to go. Well, of course, we're not really animators or social media gurus. I don't even have a Twitter handle like David for anyone, for Hala to share. So we had to bring this collaboration together. And so, we had ourselves, we had the Global Health Program that David's involved in, the Irish Global Health Network, a Global Health Group in the Irish College of General Practitioners, and Esther Ireland. And using all the expertise that these people had and the enthusiasm which helped drive us on, we started to create a set of videos. And the curriculum was developed by ourselves and the Global Health Group. We had editorial advice from David and our colleagues in St. John's. Animation was sourced through Esther Ireland, Irish Global Health Network. And Dr. Elias Peary, one of the public health doctors in Malawi, provided a voiceover and advice as well. So this all went really well. And we were delighted. We got 14 videos based around these themes, and they're all available on the Esther website and on Facebook. And you can look at them afterwards. And this was the initial response from the videos. You know, the St. John's Hospital has, you know, it's a relatively small staff, around 200 people. It has 4 associated clinics. We were absolutely delighted. We got around 1,000 views in January. We thought, this is fantastic. We're doing really well. And then we discovered about Facebook. And of course, little did I know that Facebook has such reach. And by using some advertising and being able to target the adverts to people who are involved in healthcare and to certain regions, this is now what it looked like. And as of this morning, we've had 803,000 views of these videos in almost every country in Africa. And you can see with some of this targeted advertising, this has now been sustained and hopefully will continue on. And it shares more and more, and we're getting more interaction from people across the world really about this. And one of the interesting things was that one of the ways it was picked up in social media was the Malawi Ministry of Health, who came to us and said, listen, we're actually developing training for our healthcare workers in Malawi. Can we use some of your videos? So they are developing Zoom webinar sessions for all the healthcare facilities in Malawi. The first one was last week. And as you can see, one of the first things they did was use one of the videos. And they will continue to use those for the relevant parts throughout it. So it's really been a fantastic learning curve for us in Ireland and Malawi about the power of social media for good, as well as, and be able to spread your message very widely and very quickly. Just briefly mention, of course, NCDs haven't gone away, and now we've had such success in social media, we decided we're going to take over NCDs with social media as well. But one of the things is, how do we maintain essential health services during this time? We've done this project called Compass, which is a collaboration looking at pharmacy systems, medical systems, and health systems, and trying to look at hypertension. And can we develop a sustainable, affordable supply chain of medication for people for this clinic in Malawi? We're partnering with a German NGO which focuses on sourcing good quality pharmaceuticals and creating a community that's going to develop protocols for prescribing, dispensing, monitoring, and importantly, the economic side of how this will be sustainable for the hospital itself. What about us? You know, it's not all about Malawi. Don't forget that. It's in Gori, what did we learn? A lot of teamwork. It was great to, you know, in the midst of this COVID-19, we're all overwhelmed, a lot of changing information, feeling a little bit threatened by all of this. It gave us a slightly different focus and got us to think about, well, how will our clinic address all these same issues about patient flow and clinical care? As I mentioned, we developed new skills in education, animation, and Facebook and social media. And most importantly, we remind us it's not all about us. That this COVID-19 is a global problem, and that, you know, although we felt overwhelmed and quite threatened, in actual fact, the whole world is in this together. So we've had fantastic support all along. These are obviously pre-COVID-19. It's all social distancing now, but the patients and the staff in the area have been fantastic and continue to be so during this and supporting us and supporting our colleagues in Malawi. And as we say in Ireland, the Narca Curla Kela or Malawi Mutu Mazi Senza Denga. So thank you very much, Nadine.
Thank you, Joe. Thank you. Wonderful just to hear, you know, to see what you've done, the journey. I love that you've brought us along with you on the journey, and just the power of partnership and collaboration and ideas and flexibility and willingness and commitment. So thank you for that. And I'd love if, Hala, if you could just show just a short snippet of one of the Malawi videos, and then people can go and have a look for themselves. Thanks.
Myths and facts about COVID-19. COVID-19 is a new illness and we're still learning about it. There are many stories or myths being told about how people get infected, how to prevent someone from catching it, and how to treat it. Not all of these are true. In this video, we will outline some of the stories that are being told about COVID-19 and whether they are true or not. Remember, it is important to get your information from reliable sources. Belief: COVID-19 only infects older people. Fact: people of all ages, including children, can be infected by COVID-19. However, older people and people with pre-existing medical conditions such as asthma, diabetes, or heart disease are more likely to become severely ill with the virus. For this reason, it is very important to take prescribed medications to treat these diseases as long as COVID-19 is circulating. Belief: locally made concoctions such as mixtures of garlic, pawpaw, aloe vera can cure COVID-19. Fact: unfortunately, these foods cannot prevent or cure COVID-19. The best way to protect yourself against COVID-19 is to keep at least 1 meter away from others and to wash your hands frequently and thoroughly, especially before preparing or eating food. It is also beneficial for your general health to maintain a balanced diet, drink plenty of fluids, exercise regularly, and sleep well. Relief. COVID-19 only affects white people and does.
Wonderful. Thank you so much. Great to just have a look at what those videos are. And as you say, Joe, there's 14 of those videos. So people, please go and have a look at those videos. And I also it was just striking as I was watching that, that one other quality that I would add to this is humility. And you know, it's not all about us, and nobody has the, nobody knows what to do and how to do it. And I think that's been worldwide as well during this. So thank you, Joe. I'm going to come last but not least over to our colleague in Uzbekistan, Dr. Olmajan. We're delighted you're joining us, and I introduced you before you were here, so hopefully everybody knows where you're coming from. And if you could just tell us a little bit, we're very interested to know about the partnership between Freiburg Cantonal Hospital and Urgent, is that right?
Yes.
So please let us know a little bit about that, and how did it develop during COVID?
Thank you very much, dear colleagues. Nice to meet you all on board. So I have a small project funded from Esther that supports a medical partnership between Freiburg Cantonal Hospital and that is based in Switzerland, and Urgenç Perinatal Center in Uzbekistan. The idea of the partnership is to apply spinal anesthesia in laparoscopic surgeries. So in many cases, when you have laparoscopic surgery, you are recommended to take anesthesia. But however, there are some alternatives that are emerging. For example, spinal anesthesia, that is a low gas solution, and almost no anesthesia. It leads to bring more benefits to the interest of the patient. And we are writing a research paper that would be the output of the project. And during the COVID time, we are still continuing the partnership remotely. We are taking case studies and discussing with the Swiss partners, with Uzbek partners, in order to find a mutual solutions and to write a research paper. During COVID I don't say that it influenced our project. It didn't influence very much because we are doing what we were supposed to do, and until the end of the year we will conduct a training for local doctors in Uzbekistan to take the best practices of spinal anesthesia and widen all over Uzbekistan, and then further to disseminate in all Central Asia. So this is briefly about what we are doing. If you have any questions, I would be glad to respond.
Mm-hmm. Yeah, well, I'm just interested to say that the partnership wasn't that affected by COVID, and I'm just wondering what are the lessons? Why was it not so affected, and what was it that you did that enabled the partnership just to continue to be as productive as it was?
What we did, we did a video connection of surgeries. So the surgery that is going on in Freiburg was at the same time observed in Urgenç. So the one was going on in Urgenç, video translated to Switzerland. So we were able to cope with this problem. Yeah.
That's great, and we love that the children are involved in this webinar. Every week we have children coming on behind us all, so so they're all very welcome. Good. Well, maybe I can ask you. I might just just come and ask you. I might come back to everybody and just as we're kind of wrapping up and ask you, what would your advice be to others who are involved in people who are involved in partnerships and are maybe trying to rethink how they can operate in this context of COVID that appears to be with us for some time. So what would your advice be, Dr. Olmajan?
My suggestion is changing everything to the remote mode. This is the only solution during COVID, as much as possible. For example, clinical observations cannot be easily changed, and doctors must touch it in order to learn something. I would say this is a disadvantage for our project. For example, doctors are not touching and learning from Swiss partners. This is the only disadvantage. other aspects are covered as much as possible.
Thank you, Dr. Omajan. I think we're seeing that in Ireland as well, with a lot more telephone consultations and Zoom consultations with our medical professionals. Joe, I'm sure you're doing a lot of them at the moment. Thank you, Dr. Omajan. Francis, I might come over to you and just ask you, from the NGO perspective, you know, what advice would you have for other NGOs who may be working in contexts, difficult contexts, maybe more vertically trying to respond to the consequences, not necessarily specifically COVID? What would your advice to them be around partnership? You're still muted, Francis. Still muted. Perfect.
Okay, our experience has been really the rapidly changing context, and what you consider the need today may change tomorrow. So, like somebody said, you need to be flexible, you need to be adaptive, and I think this is important to have that discussion, conversation, engagement with the donor. We are happy that Irish Aid is very flexible and has allowed the partners to adapt based on the needs on the ground. And I think that's something we are learning, and the partners hoping to have, organization with partnership, I think they need to have that flexibility across before or during, have discussions during the course for the potential changes that may need to be adopted.
Well, thank you, Francis, and we're really interested to see how this collaboration continues. I think there's lots of lessons to learn, and thank you for the work that you're doing.
Yeah, sure.
I'm going to come over to Joe, if I can, back to Ireland, and again, just ask, you've shared quite a lot in your presentation already, but is there any advice that you have for others who would be just trying to get their heads around how to be effective, how to support, how to continue to work in partnership in that unique way?
I think it's difficult, Nadine. I think, as David had mentioned, I think it's going to be remote, and trying to build that experience of how you can use Zoom and WhatsApp to do it. I think the other thing is, although we pivoted towards COVID-19, we're now pivoting back away from it, because we sort of realized COVID-19 is here to stay and NCDs are here to stay, and we now need to refocus on our original partnership and learn how can we learn together to run those services while COVID-19 is here. So I think no matter what your partnership is about, it's still very relevant, probably more than ever, and we all have to learn how to do this together. And I think there's great learnings for us all. So I think that's.
And I liked how you started off your presentation, Joe. You know, your partnership, no matter what it's about, it's also about COVID-19, and I think that's a very powerful message. So thank you for that. And coming back to you, Desilin, in Ethiopia, we'd love to hear from you as well. Just any advice that you have, or words about what people can do to continue working in partnership in these times.
Hello. Yes, the partnership, I think, as I have said earlier, we have to have a good design in the partnership. And so on our partnership, that is very good thing that benefited us much. We have designed our partnership with Irish Aid, HSC, ISQA, that is very flexible. And so we have had the hotel-based training, the country visitors, and the online. So the design is mixed, the blended type, and so that does a lot. So we should have such like arrangement in designing the partnership.
Thank you, Desilin. That's wonderful advice, and thank you for that. And we're also conscious that you've just, Nicola Brennan, your new ambassador has just arrived in Ethiopia, ambassador for Ireland. So we're sorry that she's left Ireland, but we're really delighted that she's with you in Ethiopia. So wishing you all very well with that. So David, just coming back to you then, a last word as brief as you can. Thank you.
Yeah, thanks, Nadine. Yeah, this has been very interesting to hear everybody. I think Joe's final quote summed it up very well for me. He said, "There's no strength without working together." And I think that was really the strong theme across everything. And sometimes we might think, well, a partnership is about an MOU or a structure of working, but actually partnership is about that spirit and attitude of working together. And we've seen that described today at international level, at country level, at organizational level, between individuals, teams, etc. So I think that's the key way of going forward. And then my other word was the word that Gisela used, that I was going to say, was about blended. I think we need to embrace the new ways. They do work, they're effective. That should be the major part of the way we work into the future, but we'll still need the other ways as well. And I think to build the relationships, we'll still need exchange visits. And I think it's about how to plan those so we become less dependent on the travel, and we get that right balance of some visits, but then maximizing the potential of these various digital technologies that we have today.
Mm-hmm. Thank you, David. Thank you, each and every one of you, for sharing as you did today. I'm going to come over to you, Hala, just so you can let us know what great things are in store for us next.
Okay, thank you very much, Nadine, and thank you to all our speakers for sharing all those thoughtful insights. We hope to see you again in one of our coming webinars. So our next webinar is integrated into the Global Health Conference coming up next month on the 24th and the 25th of September. Healthy People on Healthy Planet Conference, 5 years on in the SDGs in the era of COVID-19. The conference is co-hosted with the Center of Public Health at Queen's Belfast University, the Irish Global Health Network, the Chartered Institute of Environmental Health, the Northern Ireland Department of Health, and the Coalition of Aid and Development Agencies. For more information, please visit our website, globalhealth.ie/QUP/. The recording of this webinar will be available in our YouTube channels, newsletters, and websites as well. So, and now as it's over 2 o'clock, thanks to all the attendees for joining and interacting during the webinar. And we hope to see you again in our coming webinar and also in our coming conference. Thank you, everyone.
Thank you, everybody. Happy Friday.